Pilates lovers, welcome back to my channel, Annie Pilates Physical Therapist. This video is about sciatica. It's the largest nerve of our body that gets irritated on our lumbosacrospine. The most common is L5-S1 if there's a disc herniation, a bone spur, or lumbar stenosis. So get your mat ready and I'll show you some simple 4 exercises on how to help the inflammation and to decrease the irritation of that nerve. Okay, let's discuss about the anatomy of the sciatic nerve. It's a combination from L4 to S3 level. So it's called the lumbosacral plexus from the anterior posterior fibers that gets irritated. And L5-S1 is the most mobile part of our spine. And when that nerve is irritated posterolaterally, then you're gonna have leg weakness, numbness, pain down the leg, and difficulty walking. This one, and the posterolateral irritation of the disc. Usually it's the most common, which means when you bend forward, it irritates going backward and to the side. But sometimes the disc gets irritated also if we have anterior lateral or anterior medial. So sometimes you don't know how the nucleus, which is the middle part, jelly-like structure of your surrounding on your disc that's soft, that gets pushed out and started having a wear and tear outside your annular fibers. So if you have irritation, you want to make sure when you have MRI on your spine that you know where the irritation is coming from. But the most common that I'm going to do the exercises is the posterolateral. So everything is lying on your stomach today and one simple exercise on your back. So I have a pillow here that we can use because sometimes with too much irritation, because there's 5 ways of grading on how much the nerve is irritated with the disc. There's a grade 1, 2, 3, 4, 5, and 5 is a slip disc already. So if you're having bowel and bladder dysfunction and a lot of weakness now on your leg, I'm recommending you see a doctor. Okay friends, to start lying on your stomach first, you could put a pillow on your stomach. That's my first recommendation to test how much irritation is on your spine. If this makes it worse, then don't put the pillow. You can also without the pillow and feel if it's going down more. Our goal is to have the pain centralizing on your spine, because if it's shooting down more, then it's making it worse. We call that centralizing the pain. We don't want the radiation, or we call it radiculopathy. So usually it's one-sided. So if it's your left side, go down, lie down like this and engage your core muscles. So how do you engage your core muscles? You take a deep breath through your nose, pull your belly button in, squeeze your glutes and blow. When you squeeze your glutes, it helps strengthen a little bit of your glutes, and your glutes is where the sciatic nerve passes through as well, and then it helps stabilize and protect your spine as the foundation. Again, take a deep breath through your nose, pull your belly button in, squeeze your glutes and blow. Taking deep breaths are important so you engage your diaphragm. Your diaphragm is one of the most important core muscles. Again, take a deep breath through your nose, pull your belly button in, squeeze your glutes, and then you can also add imagining not to pee to engage your bladder. As I said earlier, sometimes with L5-S1 irritation of the nerve, it also helps function for our bowel and bladder. So when you do that, you help strengthen your bladder. Again, take a deep breath through your nose, belly button in, squeeze your glutes, and blow through your mouth and blow. So my recommendation is do this up to 10 times. And after doing this 10 times, then you can remove the pillow and test yourself if you can tolerate lying straight back like this. Because when you have the pillow, you're a little bit in slight flexion. So now you're straighter, and if you can do this, then try doing the taking deep breath through your nose, belly button in, squeeze your glutes, and then blow through your mouth while imagining not to pee. So do that as well 10 times. So the progression is on your elbow. We call this prone on elbow. So you take a deep breath so you feel some stretch on your low back area, and sometimes at this point of your progression you can feel there's less irritation going down your big toe or your calf. It depends on how far the sciatic nerve gets irritated, because the more it gets irritated, the more it shoots down. And then the more you relieve the pressure, the more it goes up and feels so much better. So take a deep breath through your nose, pull your belly button in, squeeze your glutes and blow. Again, take a deep breath through your nose, pull your belly button in, squeeze your glutes and blow, and then slowly go down while blowing. So I held the extension position up to almost like 10 seconds hold. So take a deep breath again through your nose, and then slowly look up now. So when you look up, you really stretch your spine more. You feel more pull on your nerve. So take a deep breath through your nose, pull your belly button in, squeeze your glutes, and then slowly go down and blow. Last one. So my recommendation is 10 times. I'm just showing you the step-by-step that you can do at home. Take a deep breath through your nose, pull your belly button in, squeeze your glutes, and then imagine not to pee and blow. And the third one is you're gonna push now on your hands. So you look up, slowly go up, take a deep breath through your nose. You don't have to fully extend your elbow. If your back is so stiff, it's okay to have it bent a little bit. So you take a deep breath, look up, pull your belly button in, squeeze your glutes, and blow and down. If the pain is getting worse, shooting down, it means you're not ready. Sometimes you have to wait a day or a few days later before you could progress to your elbow, straight to your hands. And don't ever do this with your hip extensors pushing, or else you're just hurting your spine. You have to make sure your pelvis are down, or your hip area, because we are targeting the lumbar sacral area. So you're gonna push up, and most of you with sciatic nerve irritation, your spine is very stiff. So you don't have to go fully up, but if you can do it someday, then you can hold it instead of 10 seconds hold. If you can tolerate up to 1 minute, just looking up, hold it for 1 minute. This will help the disc not to be irritating the nerve, and then the inflammation will be less, and then the pain will be resolved. Because with sciatica, it is still resolvable with proper exercise and proper body mechanics, and making sure that you are in a better sleeping position at night, and blow. So sleeping is important for healing. So again, take a deep breath through your nose, look up, belly button in, squeeze your glutes, and blow. So the last one is you're gonna lie on your back. So this is the only exercise on your back. So this is the fourth exercise. So you're gonna bend your knee. So if your sciatica is on your right side, you are gonna gently twist your both knees to that side of the sciatica, and you feel a stretch on your spine and the nerve to be less shooting down the leg. If this is causing more shooting down, then you are not ready as well. Then you really have to wait until a few more weeks of doing the back extension. But if you are having lumbar stenosis as a cause of sciatica, then this is not the right exercises for you on your stomach. For lumbar stenosis, this is a good one. So if you have a diagnosis of lumbar stenosis, lying on your back for sciatica is the best exercise. But if it's a disc herniation with posterolateral, then the one on your stomach is the best one. So again, take a deep breath through your nose, belly button in, take a deep breath and blow, and twist to the side where the nerve is irritated. So if it's your right leg, turn to the right and you feel a nice release, and the pinching pain on your back is being released. So when you're doing rotation on your spine, it helps that area. Take a deep breath. This is the last exercise, and blow, belly button in, and my recommendation again is up to 10 times, and blow. And Abel is happy with his bone right now. He loves to play with his bone and nibble it. Take a deep breath and twist. Hold it there. Take a deep breath through your nose and then blow. Last one. Take a deep breath through your nose and blow. So this is the first part of my series for sciatica. If you're doing this for the next few days and you feel better, then you can do your beginner's fundamentals of my Pilates program that you can check out. And then that's when you strengthen your core muscles, then your spine is protected. So these are just simple stretching, but the strengthening program, you can check out my videos. And I will do more parts on this series so you can progress with me. Thanks again for watching me and Mr. Abel as we learn more about sciatica, and I will do more video about it so you can progress with me gently, safely, and effectively. Please like and subscribe my channel. Ring your notification bell for future updates just like this one. I upload videos every Wednesdays for physical therapy and Pilates, like this one. Fridays for 1 hour Pilates, and Sundays for my beginners and his knees. Thanks again for watching. Have a great and healthier you. Bye!